So I'll just share a couple of those. All right, so this is a gentleman that they came to me wanting and a consult for an implant on that 4-6. So he had pain which was not very severe, but it was fairly continuous. You can see that it looks like that there's been some damage to the mesial part of the tooth, and I asked him about that, and apparently that's from the curette from his periodontist. So we basically had a chat to him about the option of doing root canal for the tooth, and he decided that he's been advised previously that it probably wouldn't be successful, and you'll soon see why I thought that was probably a fair call. So we ended up taking out the tooth, and you can see that there was indeed, quite a deep cavity on the mesial, possibly, started from the periodontist being quite aggressive on that tooth. He did have periodontal disease, which the periodontist said to us was under control, and everything was fine, and so we would be fine to do a graft and to place an implant. So this was about a year ago. So after taking out the tooth, we did a bone graft using Mineros, and then we proceeded to do the clean for him. And so we moved into, about a year ago, we moved into using guided biofilm therapy, which is a way of, I believe, cleaning the teeth a lot more effectively, concentrating on removing the biofilm rather than just the calculus. And as you can see, he's not a particularly good brusher, so that needed to be improved. And then we also started him on a daily system of using ozone to rinse with, and you'll soon see why we did that. So this is his biofilm in May 2021. So I'll start the video. Hopefully you can all see that playing. So most of the screen is moving, as you can see. So he has what we would consider to be a moderate bacterial load, low to moderate motility, as in the movement of the bacteria that's on the screen. And it's a little bit hard in this slide to see that the spirochetes, but if you look around for some wiggly little ones, you can see that there's actually quite a lot of them there. So it's really a case of trying to manage the oral microbiome and minimize the bacteria there, because if you have especially spirochetes, then you're going to have a higher likelihood of gum problems, periodontal disease, and so on. So this is 2 months later after he had been using the ozone, and this is that's not a picture, that's actually video. You can see, but hardly anything is moving there. So the bacterial load, you can see, is dropped considerably. Almost nothing is moving. I couldn't see any spirochetes on this slide. That there probably is still some around, but from certainly visually and from our point of view, this is much improved. So this was 2 months on, so probably I think 2 cleans in from where he was, and so he's in a much better position, and we're much more comfortable thinking about placing the implant. So moving on to that, so December last year, this is the biofilm that he was showing. So again, he continued to rinse during that time. So the biofilm is still very good. We're happy with how he's progressed. We've placed the implant. It's got a healing cap on it, and we're just waiting for it to heal, so that we can restore it. So the next step is then, in our case, we decided that we would really assess what bacteria is in his mouth. So we took a sample, sent it away to Microbiome Jennifer Sider, and had a look at how things were. So with this sampling, if the amount of bacteria is less than that black bar, then generally it's considered to be fairly good. I mean, it would be ideal to have none of these bacteria, but depending on your point of view, if you have periodontal disease, they say you can never get rid of it, you can only manage it. So if we can keep these numbers down, then he's got a good chance of not having a problem with that implant, and hopefully not having a problem with any more of his other teeth. So at this point now, he's just about ready to have the implant restored, and we'll be doing that soon for him. So this is another lady that came to us, and she wanted to have a chat to us about her bleeding and her mobile sort of teeth. As you can see from the OPG, there's quite a bit of bone loss. We sort of talked to her about where the bone should be and whether the bone is now, which is represented by those two lines. And she really hated cleans. She couldn't stand having any cleans because they were much too painful for her, and she would rather do without the cleans than you know, and possibly lose her teeth. So we took a sample of her biofilm and had a look, and so you can see that this is an extreme case of spirochetosis, where there's so many spirochetes on the screen that there's really not much room for anything else. So this is one which we consider high bacterial load with high motility. So you can move around on the slide and see that that really every part of the slide is filled with those spirochetes. So it's not something that you want to see. So again, we started with guided biofilm therapy and discussed, the fact that, when we cleaned the teeth, there was severe bleeding. There was severe bleeding everywhere. I cleaned her lower teeth, and I said to her, look, this is really, a bad situation for you. We need to improve this. And, the patients understand that if they're not able to brush well, look after the teeth well, that they're going to have inflammation, that there's going to be bleeding. So moving forward, and in August of this year, we got her to the point where we managed to do 4 cleans, and she's at the point now where we said, good, this is where we're at. This is probably a fairly realistic impression of what the status of your teeth health is like, which is not very good. Referred her to a periodontist, and she is not going to have surgery with a periodontist right now. She would prefer that we start with some laser treatment for her and see where we can go with that. So we're going to start doing some laser treatment for her this week, and then we will see where we can get to and hopefully improve that. But we now at least have a system where we can monitor at what point we can stop the therapy, or decide when we would consider her mouth to be somewhat healthy. So this is another patient that came in, and she wanted to have a chat to us about having that upper right 6 taken out, whether that was an appropriate action, because that's what her other dentist told her. So you can see that she does have signs of generalized bone loss, and this is really an endoperioral lesion. She was in pain, and so the decision was that we would take that tooth out and start start hygiene for her and try to manage the rest of her dentition so that we don't end up having to lose those other teeth. So what we started with guided biofilm therapy, and you can see again she's not a very good brusher. So this is just a case where she really needs to start looking after her teeth a lot better. She needs to understand the link between bacteria in her mouth and the both the bone loss and the tooth loss, and possibly what other effects that bacteria might have on the rest of her body as well. So did the clean. We've educated her on all of that, the oral systemic link, and she's brushing much better. At the same time, we also took a sample of from the pockets, sent that to MicroBlink DX, and here you can see she has everything except the AA. So when you have all of three of the red complex, then you have a very high likelihood of periodontal disease, and I think that's pretty evident with what she's got. All of those numbers that you can see are above those black bars, which means that she's not in a good situation, and it's going to be very difficult to actually try and bring those numbers down. But we're certainly going to give it a go. So this is her in May of this year, and then September of this year. So that's after 4 months. So you can see on the left hand side she really has very high levels of spirochetes and very motile bacteria, whereas on the right hand side really the bacterial load has dropped quite dramatically. There's nothing much moving on the right hand side, and again we can't see any spirochetes there. But she has been rinsing daily with peroxal. So it's a Colgate peroxal. That's a product which is equivalent to about 1.5% hydrogen peroxide. So her pocket depths are now 4 millimeters, and none of the pockets were bleeding, which I thought was pretty amazing for her. So we are going to see where we can get to, have a look in another 3 months, check, clean again, and see what her biofilm is. But as you can see, we now have a starting point. We have we're seeing some progress in terms of her biofilm, and I think she's in a much better position than she was at the start. And so hopefully we can progress and she won't end up losing any more teeth.